With CP24's Melissa Duggan. Melissa.
Yeah, Phil. So we heard from harm reduction experts today. They held a news conference inside of Queen's Park after we heard more about that bill tabled today by the Ontario government. And, we just heard from Ontario's health minister there saying that they're looking
Health minister needs to resign.
Based around treatment, around helping people with rehabilitation if they are using drugs. And the critics that we heard from today say, yes, they want to see that treatment for people who need it. They want to see them in rehabilitation programs. But the wait times to get into those services, it could take months. And there's a reality that people relapse. And in both of those cases, what these harm
And there's people that are dying in rehabilitation centers. Why aren't you saying that? Why aren't you investigating that?
In this circumstance, they will do it under the supervision of healthcare.
And your government, the Conservative government, has created an opioid crisis across the province with Big Pharma making money off the problem.
Those needles at these consumption sites and are able to dispose of them safely.
And apparently it's okay to go to the variety store and buy alcohol and knives at the same time.
Every municipality in this province better get an emergency plan in place because people are going to be overdosing and dying outside.
Yeah, and there's going to be spread of AIDS everywhere.
When we were in lockdown, supervised consumption sites stepped up and stayed open. The Toronto Public Health supervised consumption site, the work closed. What happened on that day that it closed the services? People were outside overdosing and people had to volunteer to go outside.
Years ago, the housing was cheaper, and so you didn't see the problem as bad. Now the housing is expensive, so the problem is visible. More visible now than it's ever been.
I am committed to building a world where everyone matters and where we care and value everyone in our communities. We need safe consumption sites. I urge you to keep them open. They are a part of a safe and caring world that we gift to our children.
Something else we heard from the Ontario government today, they're saying that they want to close a loophole that would allow community centers to look to the federal government for their funding to open safe consumption sites. But now the provincial government is saying, no, they're going to close that loophole.
Things won't change until it starts to affect the Conservatives' kids. Once the Conservatives' kids are affected, that's when they'll actually do something.
Sites opening up in this province as long as this government is in power.
And there's solutions of closing safe injection sites won't work because there's a reason why they were created. One of the reasons was because the mass spread of AIDS.
Those are here in the city of Toronto. And
the other reason is overdoses.
Expected to pass, these closures would take effect before the end of March. Back to you.
Melissa, thank you for that recap.
Oh, really? The biggest bully around is Doug Ford. This government knows nothing of mental health at all.
Safety in our schools alone.
Resign, resign, resign. We're tired of you. Resign. Your government sucks.
It's our shared responsibility to create the best possible conditions for learning and growth. And with your support,
maybe you should do some learning because you obviously know nothing about education.
by working together, we can ensure that every child feels safe.
You don't work together. You're a bully. Just like Ford.
I remember the tremendous I had.
How much did the Conservatives pay to do this speech, bud?